on the ideas, expectations, and concerns. So let's talk about the. I did talk about that how you are going to manage someone with the back pain and how would you explain that why you need to do the back passage examination. The consent is important in the back passage examination. That is very important. Why? I'm just giving you one example why you always need to tell them. When there's a private examination, like intrusive examination, you need to mention that. Apart from that, signposting is important. For example, you are going to be a bit intrusive in someone's sexual health. You need to mention them that I will be asking few intrusive standard questions which we usually ask from everyone having similar complaint. You will signpost that. Otherwise, it will be a shock for them that you straight away ask, are you sexually active or something? The signposting is a key again. So that's the important thing you need to understand. Apart from that, so I will try to talk about a little bit more about signposting and how where you need to take the consent. So, for example, in examination, what are the examination where you need to take consent? So, for example, PR examination, will you need to do the consent as well? Yes or no? Just tell me yes or no. Write in the chat box. In the eye
Yes.
examination, yes or no. Write in the chat box. Eye examination. Will you need the examination? Yes, sometimes. Okay. Do you need chaperone? Do you need chaperone in PR?
Always.
Yes or no? If a patient says that I don't need chaperone, what you will answer that? I will come to that. I will tell you this important eye examination, fundoscopy. Do you need examination? Abdominal examination. Do you need consent or chaperone or yes or not? Consent and chaperone, yes or not? You need to, or maybe sometime. I will say that sometime, yes or no. And let's talk about other nerves examinations, like you are going to check the nerves of body. Will you take chaperone or consent, yes or no, for that? And in examinations, examination you always do, what examination you always do, and what examination would include in that obs will always you do. Oh, can you skip examination? Can you skip examination, yes or no? Just tell me yes or no. So there are a couple of questions I'm going to ask. When you're going to skip examination, when you're going to take chaperone, will you do observations? What observation you will do? You need to understand these things a bit more. So thank you very much. Everybody say yes, yes, yes. Thank you, Nisha. Thank you, Farhana. Thank you, Hira. Yes, so it's a quite a different thing. So chaperone is not for always for the patient. Chaperone is basically for someone, for the both, for doctors as well. So yes, I want to tell you bit by bit one. So for me, like someone says the abdominal examination, I know we are short of staff and I am going to do abdominal examination, just a general abdominal examination. I might not take any chaperone. I might not take any chaperone. But if I feel like I do need to take chaperone, where you feel like the patient is of like you're getting a bit intrusive, is a sexual history is there, I would take a chaperone. If the patient says that doctor is all right, what you will answer? How would you proceed? Let's say Allah. If I say that's all right, doctor, I don't need chaperone, what you will tell her? You will not say that I'm taking chaperone for my own safety. You will say that I understand, I respect your decision, but at some point I'm going to ask one of my colleagues to be with us to for your comfortable that you are comfortable and I am comfortable to do this examination. Okay, for the both safety and for your dignity and for your privacy. Okay, you will mention that. Guys, always take chaperone in back passage examination even after your practice. Even like for example, if you are male and you're going to do the back passage examination, even the chaperone who is with you, you will tell her to come forward that how you're going to do the back passage examination. Why? You can tell the chaperone that you can come forward, not in the PLAB-2, but you will say that you can come forward that how I'm going to do that. Am I inserting in the back passage? Because there are a lot of cases, sometimes doctors get complained that was not back passage, that was front passage. The only thing is that would save you is the chaperone. the chaperone, name of the chaperone, and sometimes even these type of cases when you don't communicate them why you're taking them chaperone. In these type of cases, the doctors, the only thing which can save them the gloves. Sometime when the police come over or something like that, so the gloves will tell you the which part of that. That is not from for the PLAB-2, but I want to tell you the importance of chaperone in intimate examination. Yes, always in the PR examination, eye examination always, because you are going someone very close to their face, mouth. So there are few complaints they can do that. The doctor was so close to my mouth, my face, my lips. So in this way, you do need chaperone in there as well. Abdominal examination, yes, you if you don't have chaperone, you don't need to manage nerve examination, other examination which are intimate, not intimate, don't mention chaperone. Yes. So can you skip examination? So you shouldn't skip examination in PLAB-2. You always verbalize. So you need to verbalize. You don't need to do examination in every station, every PLAB-2 station. When you will mention examination, whatever examination you will mention, that particular, they will give you finding on the piece of paper. You mention examination, they will give you findings. So there is another point here. If you get the findings, will you explain this finding, yes or no, to patient? Whatever finding, for example, abdomen is acute, yes or no. When you get the finding, for example, pain in tummy, whatever,
Yes,
for example, you get,
yeah.
where you will struggle, I will show you after the lunch. Whenever we get a lunch break, I'll show you a marking scheme. In the marking scheme, I will show you the picture of the marking scheme. It will tell you findings. If they put a tick box on the finding, that means you haven't explained findings to the patient. They're expecting you to explain findings to the patient. Whatever the finding is, you need to explain. Then those findings, after getting that finding, you will move to the diagnosis. That you will move to the diagnosis and you will explain diagnosis to the patient. So this is what you need to understand about examination, guys. So this is here, I'm on the ebook now. Okay, so examination, simple words, consent, basic investigation. You know the understanding where you are. GP setting, A&E, do as much as investigation you want. You want CT, go for it. You want MRI, go for it. You want this, go for it. But GP, only standard bloods, urine dip, bedside test you can do according to the complaints. Okay, then if finding, explain findings. If you don't explain finding, you will not be scored on the findings score. Yes, guys, another question. Write in the chat box, guys. I can see a few faces here. Write in the chat box.